The impact of childhood obesity could become a big financial burden as well as a quality of life burden across this country. A worst case scenario would be that obesity continues to increase very rapidly in this country, especially among children, that they're going to be suffering greater and greater amounts of disabilities and their life expectancy is going to be shorter. It could put a huge financial burden on our healthcare system, which already is growing at nearly double digits every year.
It's sort of like a faucet that drips and just keeps dripping and keeps dripping. And as the faucet drips and drips and drips, it erodes and erodes and erodes. And I think if we think of the obesity epidemic as sort of very little incremental gains across a long period of time, eventually people just keep getting bigger and bigger.
And there's no doubt the mandate of schools in most states is to educate children. But that education is sometimes, in my view at least, is narrowly defined in terms of the sorts of content which is on the statewide academic achievement test. So that means math, it means writing and reading comprehension and things like that. So what's left off the table is physical education and physical health.
I'm going to be thrilled if my child gets into Harvard, but if they're obese or if they have a health issue because they haven't been exercising, the other doesn't really, it's irrelevant. Health is the most important thing, and unfortunately most people don't realize it till they don't have it.
We need an intervention program. We need a holistic intervention program that has different components, not just the curriculum and not just the family component, but PE and also looking at the foods that children eat at school.
Canadian culture is very similar to American culture as much as we want to say that it isn't, but in fact we are adopting all the same behaviors. I mean, it's driven by the internet, it's driven by television. Fast food is a huge driver of the way kids eat. Where we're standing today, we're only about an hour from the border, so you can see that everything crosses that border. You can tell that the issues that you have here are exactly the same, and we cannot be complacent and think that it's not.
Every PE teacher should try to incorporate some kind of program because we're getting to the point you can't just have physical activities, you got to start teaching them how to live a healthy life.
What about oranges? Whose favorite fruit's an orange? 1, 2, 3.
Coordinated school health programming is a process that brings schools and communities together to teach children how to be healthy for a lifetime. So the CATCH program is a resource. They're the tools that bring schools, families, and communities to start working together to create that healthy school environment.
CATCH has been a very, very well-studied program. There's been 11 different funded projects to investigate different aspects of CATCH. If you apply this form of intervention at schools, that is classroom curricula, physical education, changes in the environment with regard to food and the food service, the types of foods that are served, as well as reaching parents and reinforcing it at the school and home, you can expect changes in diet, which are reductions in fat content and salt, and also increases, actually fairly big increases in physical activity.
We chose CATCH because it was evidence-based and because that was a requirement of our department that whatever we were using be evidence-based. We also chose it because I feel very strongly the premise of the development of CATCH was that we not give kids just knowledge, but give them experience and exposure to how they could change their own behaviors.
We had read about it. We were impressed with the literature and the science-based evidence that it really made a difference in the health of children. But we were interested in seeing whether or not it was a good fit for our community. And so we pilot tested it in 2 schools, and from then on it was like, this is what we want to do. This really makes a difference for the health of the children. The teachers like it. The families give really positive feedback about the information the children bring home. And so from then on we decided to be actively searching funding sources to bring it into more schools.
We saw the data, we liked it. We had an initiative going on at the time where we were funding local health departments, and we offered CATCH as one of the programs that they could choose.
When the CATCH program first came out, that was one of the first programs, basically the only program that I'd seen that had a physical activity component. And it was, to me, a no-brainer not to jump on that program.
This was our opportunity to really make a systemic difference, because we did have food service sitting with us. We have the school nurse that goes in and helps do BMIs, weights, blood pressure monitoring of all the kids in all the PE courses now. We have the school counselor doing some health counseling. We have those health lessons that kids are talking to their parents now, because I get more parents that crack me up. You know, they came home and critiqued what we had for dinner last night. I'm like, well, that's a good thing, because what we found with Catch is it changes your behavior.
When you go into a Catch school, you can see that there's something different going on there. There's a value about health, not only for the kids, but also for the staff. Sure, math, science, English, all very important, all a high priority within the school. But there's also that shared value about being healthy.
Bananas, makes pretty color there.
Bringing a new program to a school, you never know what's going to happen, but this one, in targeting child health and getting all kids involved with small group instructional lessons related to physical education, it's been incredibly positive.
I just feel that we can influence what children eat as far as even when they grow up, what they learn here in this building. And if we can affect 10 or 20 lives when they become adults, if they have learned that this is how I'm supposed to eat, I'm not talking dieting and that type of thing. We need to teach children to eat healthy from the time they're in kindergarten, actually even before that, so that when they grow up, they don't have the health problems that so many adults are facing nowadays. And I think this is the age to catch them at.
At times in the past, we've had games that were competitive based, only, basketball or football or kickball, and now we have games where we're moving, we're having fun, but no one's like, I won, you lost. And before they know it, they've worked for 30 minutes and they're having fun.
What's happening with the dissemination of Catch nationally right now are all the different stakeholders stepping up to the plate to help schools and their communities teach kids healthy habits for a lifetime. We're seeing foundations becoming involved, we're seeing hospitals becoming involved, health insurance companies, state and local health departments and education departments, the list goes on. And really, that's what it's going to take.
The Catch program presents an evidence-based program for the hospital, and in healthcare we all know that we really need to show how a program can truly impact the health. So we made a determination that we would continue and pick up literally and add on to the work that had been done previously, because we knew it was the right type of thing this community could really embrace.
When I talk to my colleagues, how the heck did you get to all of this? I think number one, the funding made it possible, but the funding was possible because of the proven curriculum, and I think that's what a lot of Ys tend to do, is want to reinvent the wheel. Well, we can do it different, we can do it better, and we didn't do that this time, which we've done a lot of times, and we were able to take the curriculum and use it in the form that it was intended, and find a way to duplicate it. And that's what many Metropolitan Ys are searching for, on how to be able to do that and do it consistently.
We are part of a community-wide consortium called the Steps to a Healthier Houston-Harris County. The consortium worked very closely with the Houston Foundation, which is one of the major philanthropic organizations here in the Houston area. They funded our proposal to bring Catch to over 400 schools across 22 independent school districts in Harris County. So we're very excited about this project and what we think the potential outcomes could be on a community-wide basis.
To translate research into practice, the universities have partnered with Flag House. And Flag House over the years has really not just been a publisher and a distributor of the program, of which the universities are just not geared up to do, but their role actually with the schools has changed.
There are so many unsung heroes in Catch, and we think they need to be brought to the forefront, because they're the ones that are changing their community step by step and day by day, and we want to provide a forum for them, and the University of Texas is helping us do that. They're also helping us build a cadre of trainers on a national level that is without peer. They're bringing some of the strictest standards and some of the best training methods to the table, and we're using that to train the trainers so that when we implement catch across the nation, we're sure that people get off on the right foot.
We often conduct studies, write the papers, develop innovative programs that from that point on sit on the shelf somewhere. And ultimately, I think the success of any program should be judged on the basis of the extent that it has an impact on the health of the public. And I think catch is well on its way for doing that.
As parents, anyway, think of the school system as this big bureaucracy that we can't nudge, we can't necessarily influence. But when you work on a little smaller level and take one classroom at a time, it's been a very positive experience.
So far as I'm concerned, catch is still the broadest program that is evidence-based that continuing research continues to support. The combination of what they hear from their classroom teacher and their PE teacher and their school nurse and what they see in school food service all combines to make it doable for the kid.